So picture this. You spend billions of dollars on an AI. You partner with the world's best hospitals, and you promise to completely revolutionize healthcare. And then, years later, you just quietly sell off the business. This wasn't some scrappy startup that failed. This was IBM Watson Health. Today, we're going to unpack how one of the most ambitious, most expensive bets in the history of AI went so wrong. Let's start with the number at the absolute heart of this story: $4 billion. That's the mountain of cash IBM poured into buying up healthcare data companies to build the foundation for Watson Health. This was never a small experiment. This was a massive, go-for-broke play to dominate the future of medicine with AI. Which brings us to the big question, right? With that kind of money, with the legendary power of IBM behind it, and with an AI that was literally a celebrity, how did it all just fall apart? How does a project with so much promise end up delivering, well, pretty much nothing? That's what we're going to figure out. To really get why it failed, you first have to appreciate the promise. And let me tell you, it was incredibly compelling. After Watson totally crushed the best human players on Jeopardy, the thinking at IBM was, hey, if it can master that, why not apply that same brain power to one of our biggest challenges, healthcare? The dream was to create this amazing tool that would help doctors make better, faster diagnoses. The entire strategy was built on this beautifully simple idea. If you have better data, you can make better decisions, and that will lead to better patient outcomes. It sounds so logical, right? Almost elegant. But that clean little equation completely ignored the messy, complicated, and very human reality of medicine. And right here is where the first major cracks start to show. The problem wasn't a bug in the code or a faulty algorithm. No, the problem was baked into the entire blueprint from day one. It was a fundamental misunderstanding of what they were even trying to solve. This really gets to the heart of it. IBM looked at medicine and saw a data analytics challenge, just patterns and numbers. But what healthcare really is a context and judgment challenge. It's about navigating uncertainty, experience, and the unique patient sitting right there in front of you. So this disconnect created this huge gap between the AI and reality. For one, medical data isn't clean and tidy. It's a total mess of scribbled notes, lab results, and images from a dozen different systems that don't talk to each other. Plus, clinical decisions rely on nuance, things a machine just can't easily pick up on. IBM was trying to build this one-size-fits-all solution for a problem that is deeply local. So when you start with a flawed blueprint like that, it's really just a matter of time before the whole thing crumbles when it actually hits the real world. This is the story of how that grand, revolutionary promise met the harsh, messy reality of the hospital floor. And the collapse didn't happen all at once. It was more of a downward spiral. First, just getting Watson integrated into a hospital's existing systems was a total nightmare. Then, when it did work, the recommendations it gave were often way too generic to be of any real use. And that led to the real killer. Doctors lost trust in it. And once doctors don't trust a tool, they're not going to use it. It's pretty much game over. And this is a really crucial point. This wasn't a story of doctors rejecting technology. No, they rejected a tool that didn't fit into their workflow, that didn't respect their expertise, and that just didn't get the reality of their day-to-day jobs. This wasn't just a technical misstep. It was a colossal business failure. We started with that $4 billion number, and now we're going to look at the return, or maybe I should say the complete lack of return on that massive investment. If you had to sum up the entire project, this is it. High cost, low impact. Despite that gigantic investment, hardly any hospitals actually adopted it in a meaningful way, and the impact it had on patients was almost impossible to even measure. It was all cost and pretty much zero benefit. The timeline really tells the whole story, doesn't it? It all kicks off in 2015 with this huge, ambitious launch. But then, for the next 5 years, all you hear are these reports bubbling up about struggles on the ground. And it all ends with a whimper in 2022 when IBM finally sells off the assets, basically admitting the whole thing had failed. Okay, this right here is the most important part of this whole explainer. It's so easy to look at this story and just say, see, AI in healthcare is all hype. But that is totally the wrong lesson to take away. This is not a story about the failure of artificial intelligence. It's a story about the failure of strategy. IBM's entire strategy was propped up on 3 incredibly weak assumptions. First, they assumed that just having more data automatically creates value. Second, they believed one single AI could somehow generalize across the entire vast world of medicine. And third, they fell into that classic tech trap of thinking, if you build it, they will come. All three were just dead wrong. Look, if you only take one single thing away from this today, please let it be this. AI success is less about how sophisticated your algorithm is and way more about how well you integrate it into the real-world context. A simpler AI that actually fits into a doctor's workflow is infinitely more valuable than a smarter AI that doesn't. So what does a good AI strategy look like? Well, it looks like this. You start by designing for the real world, not some perfect ideal. You make sure your tech geeks and your domain experts, your doctors, are building it together. You make earning trust your absolute #1 priority. And from day one, you know exactly how you're going to measure whether it's actually working. Which leads us all with one final, and I think, crucial question. Watson Health failed because its grand vision was totally disconnected from the messy, complex reality of healthcare. As every single company today rushes to adopt AI, the $4 billion lesson from IBM is to just stop for a second and ask, are we building something for the real world, or are we just falling in love with our own cool technology?